All right, let's dive right in. Today, we're taking a closer look at the world of chronic illness, specifically some of the really advanced treatments that doctors might turn to when the usual stuff just isn't cutting it. Think of complex, persistent infections like chronic Lyme disease.
So, here's our game plan. First, we're going to meet the enemy, these incredibly stealthy invaders. Then, we'll look at two very specialized tools in the treatment toolbox. After that, we'll see how they stack up against that awful brain fog. We'll also cover the all-important antioxidant support team. And finally, we'll wrap it all up with the single most important expert takeaway.
Okay, first things first, the stealthy invaders. You can't talk about a solution until you really truly understand the problem you're up against.
So what are we even talking about when we say stealth infections? How do these things manage to hide out in your body for so long, and what makes them so ridiculously hard to get rid of?
Well, let's look at a classic example, a little troublemaker called Bartonella. Now, the two words you really need to remember here are stealthy and persistent. See, these guys are masters of disguise. They don't just float around waiting to be attacked. They actually hide inside our own cells, effectively becoming invisible to the immune system, and that is what can lead to these stubborn, long-term health issues.
And Bartonella rarely shows up to the party alone. It's often carried by fleas, lice, and especially ticks, which is why it's so frequently found as a co-infection alongside Lyme disease. Now, you might have heard of it as the cause of cat scratch disease, but that's really just its best-known form. In chronic cases, believe me, it can be a whole lot more serious.
So how in the world do you fight an enemy that knows how to hide so well? Well, that brings us to two specialized tools that doctors might pull out in these really advanced cases.
First up in our toolkit is a medication called Dapsone. And right off the bat, you should know, this is not your standard run-of-the-mill antibiotic. No, this is a highly specialized instrument for very specific situations. Let's find out why.
Dapsone's real power comes from its 1-2 punch. First, it's a powerful anti-inflammatory. It specifically dials down neutrophils. Think of them as the immune system's overeager first responders who can sometimes cause way too much inflammation. Second, it's also an antimicrobial, targeting certain bacteria and protozoa. So it's this unique two-pronged attack. It fights the bug itself, and it calms down the inflammatory chaos the bug creates.
Now, I gotta be really clear here. Dapsone isn't something that's prescribed lightly. It's really reserved for niche situations, like when a patient has autoimmune issues affecting their skin, or when lab work shows that those overactive neutrophils we just talked about are driving the inflammation, which can be a huge problem in tough Lyme and Bartonella cases.
All right, let's check out our second tool, methylene blue. Now, this stuff is fascinating. It's actually a compound that's been around for a very long time, but it's getting a whole new lease on life for its potential in these complex chronic illnesses, and it works in a completely different way.
Methylene blue really seems to shine for patients who are struggling with neurological symptoms. It's also being used for another tick-borne bug called Babesia, and for people with mitochondrial dysfunction, which is just a technical way of saying their cells are having a really hard time making energy. It can also be a great option for people who just can't tolerate some of the harsher antibiotic regimens out there.
Okay, so we've met our two contenders. Now let's put them in the ring and see how they fare against one of the absolute worst, most debilitating symptoms of chronic illness, that crushing brain fog.
And this right here is where you see the massive difference between the two. Methylene blue has a superpower. It can cross the blood-brain barrier. Think of it like a security checkpoint for your brain. Very few things get through. Well, methylene blue has an all-access pass. This means it can get directly into the brain and help the neurons, the brain cells themselves, produce more energy. Dapsone, on the other hand, can't do that. Its job is to fight inflammation and infections out in the rest of the body.
So, because of that special access pass, methylene blue really starts to look like the better candidate when someone is dealing with that severe, unrelenting brain fog, or that deep, chronic fatigue that just doesn't get better with antibiotics. That frustrating cognitive slowdown, the memory lapses, or that feeling of constantly searching for the right word.
Now, these targeted treatments are incredibly powerful, but they don't work in a vacuum. And frankly, they can be pretty tough on the body. And that brings us to a piece of the puzzle that is absolutely crucial, the antioxidant support team.
See, fighting a chronic infection creates a ton of collateral damage inside the body. It's a process called oxidative stress. The easiest way to think of it is like cellular rust. It's the wear and tear from a long, hard battle. So to combat this rust, you need a dedicated support crew of antioxidants. And the A-team here is made up of 3 heavy hitters: glutathione, N-acetylcysteine, or just NAC for short, and vitamin C.
First up is glutathione, and it's called the body's master antioxidant for a very good reason. It is absolutely vital for detoxification and for helping to keep the immune system in balance. It's especially useful for that deep fatigue and those neurological symptoms we've been talking about. But there is one important heads up. It's not a good fit for people who have a sensitivity to sulfur.
Next is NAC. So if glutathione is the superhero, you can think of NAC as the factory that builds more of those superheroes. Your body uses NAC as a raw material to produce its own glutathione. But NAC has another really cool trick up its sleeve. It can help break down something called biofilms. Imagine bacteria building these slimy little fortresses to hide from your immune system. Well, NAC helps tear down the walls of those fortresses.
And finally, we have good old vitamin C. We all know it's great for immune support, but its role here is way more sophisticated. It helps ramp up the body's detoxification pathways, and, this is the really cool part, it helps recycle other antioxidants, especially glutathione. It basically goes around and recharges the rest of the support team so they can get back in the fight.
Phew, okay. We've seen the sneaky infection, the specialized tools, and the essential support crew. So what's the big picture here? Let's pull this all together with the expert takeaway.
This quote right here gets to the absolute heart of the matter. Lab tests, they're critical, of course. They give you objective data, but in really complex illnesses like Lyme, they are never the whole story. They're just numbers on a page without a skilled practitioner to interpret them.
And this leads us to the single most important point of this whole explainer. There is no magic bullet. There's no one-size-fits-all protocol that works for everyone. Real, effective treatment is much more of an art form. It's this careful, delicate balance between the lab results, the doctor's clinical experience, and a plan that is completely tailored to the individual patient.
So when you look at all of this, from these super specialized tools like Dapsone and methylene blue to the vital supportive antioxidants, you start to see this bigger shift happening. And it leaves us with a final question to really think about. Is the future of medicine less about finding a universal protocol for everyone and more about perfecting the art of truly individualized patient care? Thanks for digging into this with us.